Straight on, Liz. You've already had a pre-mention from our boss.
I would actually just like to say thank you to Sue for those words, and but my team.
Yeah, what a great team, what a great piece of work, and share the story. Thanks, Liz.
So I'm going to present the exceptional care and in time, which was the aged care rehab review that we did. So at the end of about 2016, there were some major concerns throughout the department at all levels that things were not good in aged care, sort of a little bit crook and Tobruk really, but rehab, but especially so. But especially so if you were a junior staff member on Ward 12. So we started off brainstorming, and as you can see, there were loads of tasks that were required to be done, and married these up with the issues that had been reported to Sue in her yearly Grade 1 interviews. Things like loads of overtime, no time for quality, perception of having to work through lunchtime, lack of equity compared to other similar rotations, senior staff covering up by staying back all the time, and we came up with these two main issues, so that the case mix and caseload was too complicated and demanding for the present model of care, and for that to be managed within the normal staffing and within normal work hours, and reportedly that there was a negative staff experience and lack of opportunity for improvement for things like quality and learning. So once the issues were identified, we came up with these goals for the project. So staff leaving on time regularly, but still providing a best practice rehab program, a framework for all staff to prioritise and manage their caseload, and working in aged care at REPAT is to be a positive or a desired experience for all staff. So how did we get a measure of the size of the problems? So we did a time map of all Ward 11 and 12 staff over a week to get a snapshot of overtime done, how often breaks were being taken, or as the case was not being taken, and trying to see if there was anything in particular that was taking up more than a reasonable percentage of the day. We repeated this time mapping 6 months later for comparison, and we still plan to complete one more at exactly 12 months post the original data collection. We also conducted a culture audit, which was a little bit different from something different from a physiotherapy department, and we conducted it through all levels of staff using slightly different methods, which you can see. The audits all had a similar theme, but were adapted to the level of experience, and were related to the now, old Austin values, so it was at the time, including questions that related to the MDT as well as the physio department. So what did we do to address these issues? Guidelines were formalised for patients that have achieved all physiotherapy goals but have not been discharged. This frees up therapists' time to provide better targeted treatment to the patients with active goals. Similarly, guidelines for management of caseloads in the event of unplanned leave meant that the staff had a plan of action that they feel confident to use both within physio and with the MDT. Benefits from previous projects like Cerner referrals, which have been presented at this forum last year, for groups occurred at this time, and the department sorting out reliable inter-campus IT issues with Zoom has improved educational opportunities and connectedness, which is great, without having to travel regularly. Also, the education sessions at REPAT are now more specific to aged care, and our morning tea break is now set in stone. So, the results. This is some of the results. So this here is a graph of the amount of overtime. It's the data we collected from the mapping process, and you can see that if you look at it here, so the green and the blue is for the senior staff, the green being the first lot of data collection, the blue being doing 6 months later, and the purple and the red is for the grade 1s and 2s. Once again, the purple being for pre and the red being post 6 months. So you can see that the grade 1 and 2 have improved each day, but perhaps the senior staff need to work a little bit on consistency, but I'd like to tell you that all the staff working on consistency. And actually, when we crunch the actual data, the overall overtime has decreased by about 20 minutes per day on average, so we've still got some work to do. The next graph is the number of tea breaks taken. So you can see here it's a much more impressive graph, and the blue was the initial data collection, and it shows that in the green was the post, and we can see that there's a fairly consistent percentage of staff are taking their breaks, and it would be good to get it closer to 100%, but we're working on it, and we're working on it really hard, and this is the real picture. Okay, so the next step. Morning tea has become interesting. It was an unanticipated benefit of setting a formal morning tea time is that it's become a touch point in the day. Asking for assistance for unforeseen workload issues at morning tea time gives the team more time to prioritise across the stream to accommodate fluctuating workloads rather than waiting till lunchtime to get it sorted out. Senior staff are continuing to work on prioritising workload to leave from the front as far as leaving with overtime. And as expected, great work like the discharge ready guidelines have been shared and adapted with our other subacute colleagues. So the in-time part of the project is complete apart from re-auditing the grade 1s at 12 months post the initial session, which we promised to do. So the insights. I guess the thing that I would like to say is never underestimate the brilliance and enthusiasm of your working party. And hence, with the exceptional care part of the project, it's become apparent that there were many facets to look at that coincided with reviewing both subacute campuses' compliance with things like stroke care guidelines, suitability of different groups, and providing efficient and optimal treatment dosage to a changing patient demographic. And I just want to bring you back to our third goal, which was working in aged care at REPAT to be a positive and desired experience for all staff. As you can see, we haven't quite got the result of our culture re-audit yet, but anecdotal evidence would suggest we are on the right track. And I would just like to say a huge thanks to all the staff.
Thanks, Liz. Great work. I hope everyone already knows, but it's been well established in the literature that when you look after the staff, you look after the patients. So you get better safety outcomes, you get better functional outcomes. Everything goes better for patients when the staff are happy and engaged, and this is a really good example about sometimes it's important to turn the focus onto yourself and make sure you're doing the right thing by yourself and your team, and that the results for patients will come from that. So thank you very much, Liz, for sharing the story, and thank you all of the staff who felt that they were confident enough to speak up and say that it needed to be better, because if we didn't get the feedback we wouldn't know. And so I think that's an encouragement for the future, that if there's things that you think need to be better, please find someone to tell so that we can get that feedback and respond. So the other little task we put out in the break room today is give you a bit of feedback about how we've responded to the staff engagement survey feedback. It's really important that you trust that we want to hear how you feel and what's going on, and also that you believe that we'll do something with it. And I think this is a fantastic example of that. Thank you, Liz.